Welcome back to I'm Still Here. I'm Larry.
And I'm Heather. In 1998, at the age of 26, I was diagnosed with stage 4 breast cancer. It changed everything for us, but I'm still here.
Yes.
Big head nod for those of you not watching. It's funny because I never think of people as watching, but I know some of you do.
Oh.
So,
okay.
Anyway.
So we are past the halfway point in our 5 to Thrive series.
Yeah.
What is the 5 to Thrive series?
5 to Thrive series is a look at kind of 5 focus areas that we have determined that were really kind of the crux of what helped me the most as I have dealt with having metastatic breast cancer. And we broke it down into 3 different parts. So we already have done kind of the time from being diagnosed or in the process of being diagnosed to starting treatment. We reviewed all 5 things. So it's mental, physical, nutrition, medical, and support. Mm-hmm. And now we are in the kind of treatment phase of life with metastatic breast cancer. And we're back doing all of those things. Today we're going to talk about medical.
Right.
And then, so we're going to finish up this part of the series with medical, and then we'll talk about support. Then we're going to kind of talk about sort of that life after treatment and all of the components again, because it is really a different time of life, and it can be really challenging and scary. So.
And we're certainly not covering everything you might ever want to know about all of these things. This is just from Heather's experience and what she went through, or even some things maybe she would have done a little differently.
Yeah.
And
some things are, like we're talking about, like immunotherapy. I mean, that wasn't something that was on the table for me, 25 years ago. So right at the beginning. So, yeah.
So the medical that we're going to be focusing on today is chemotherapy, radiation, surgery, which could be a million different things, and immunotherapy. So in those kind of segments, kind of advice.
Yeah. So I think there's kind of, as you're getting into this part, it can feel like a huge relief to be knowing that, okay, we're doing something. It was a huge relief for me anyway, to be able to think, okay, something's being done from a treatment standpoint. We have a plan. We're going to start executing it, right?
Especially for the people who had to wait a little bit.
Yeah, yes. It's so terrifying. And also because I think, in the process of being diagnosed, sometimes you get like this message like, oh man, we need to hurry, right? This is really bad. And other times it's kind of like you feel like you're waiting forever for things. So it can be really challenging. But kind of getting into this, I think that with anything overall from a medical standpoint, you kind of want to know what the plan is. And there's kind of this saying out there, it's like scan, treat, repeat. But it is nice, regardless of what type of treatment you're doing, to know kind of what your schedule is going to look like in terms of scanning, which is really the thing that determines.
Which definitely falls into medical. Also, we should say is all of the testing is also medical.
Oh, for sure, absolutely, and scanning comes with its own problems and anxieties, kind of more than anything. I think we've maybe talked about this some in the past, but like we know, especially when you have metastatic breast cancer, that scan, that whatever you're doing really can have an impact on what your life looks like going forward. So
for sure.
But so just knowing, I think from the get-go, it's always good. One, to have a team that you feel confident in. So this is a time where if you still, or even if you start something and you don't feel good about it, get a second opinion. It's okay. Like, go do that. I think, again, sometimes we feel so much like we need to start something. And I would say that I think the peace of mind of knowing that you're doing the right thing is worth a little bit of extra time. Or you can even start something and you can change paths if you need to, like nothing is written in stone. And if you feel terrible about what's happening, I think you need to.
Why do you think people don't get second opinions?
I think I think part of it is that they want to get going. They just want to get going and get rid of the cancer. Mm-hmm. I think there's also a part of us, as women especially, that we doubt. We have been taught to believe what somebody says and not to push back on it. Mm. You know?
Okay.
So I think this is a really important time to kind of listen to that voice in your head. If you, even if you feel like the person is a great person, but they don't communicate well with you, if you can't get around that communication barrier, either with somebody else helping you, then that still might not be your person, so...
Yeah. Or place.
Yeah. Exactly. And having been to multiple places over the years, there is a very different feel to places. So, sure. And, you do need that mix of feeling confident in what they're doing and also feeling like they do have the time to communicate with you and all of it, knowing that you're a part of the team, I think is really important.
Just being taken care of in the way that you want to be. And that is not the same for everybody.
No, absolutely not.
I think some people may not get second opinions also because they're intimidated by the subject.
Yeah,
absolutely. And they don't know, and so they just assume this is what everybody does.
Yeah.
That's where someone on your team, which we'll talk about in our next episode, can really do the research and find out whether it is the norm or whether, no, this shouldn't be that way.
Right.
Yeah.
And I mean, there's other things that influence it too. I mean, sometimes distance is a problem.
Yeah.
I think distance has been overcome by some of the Zoom and telehealth stuff that they've been doing. But again, for me, distance wasn't going to be an issue. In fact, we felt way more secure knowing that we were going to a major medical center. So again, it's just what's your level of comfort with those types of things.
But other people we know go to a local hospital here,
yeah,
and I'm sure they get great treatment. And that is right for them. That's what works for them.
Yeah. So just jumping into the first thing that I did, and so kind of the first thing that we always come to first is chemo. So chemotherapy, I think in some ways can be worse than what you think, and in a lot of ways can be way better than what you imagine it might be.
Sure.
So what I thought chemo was going to be was, immediately losing my hair, throwing up all the time, like whatever
not being able to get out of bed,
not being able
energy,
exactly, being really thin, all of these things, just being, kind of the stereotypical what you would see in a movie type of situation. Right. And that's really not how chemo is necessarily.
For you.
It
wasn't how it was for you. I think with all of these, we go back to what was your health going into this? It does matter. Just that when we talk about the physical and nutrition side of it, the healthier your immune system is, that's going to help that chemotherapy and recover from this poison being put into your body to kill fast-growing cells. The stronger your body is to legitimately fight that, because that's what it's going to do. Mm-hmm. The side effects won't be as great in a lot of instances. But if your immune system's really, already knocked down, and then you're getting this poison into your body, absolutely it's going to affect you more negatively.
Yeah. And maybe, too, if your immune system's a little stronger, you can bounce back a little better, or you just don't go as low. All of those things can have an impact on how you feel, when you're doing chemotherapy. But I think, the important thing with chemo is, one, to know, like, it is a kind of an event to get chemotherapy for the most part. When you're getting an IV of something, a lot of times there's pre-meds. A lot of those pre-meds can cause, like, sleeplessness. They can cause, just some other things. So So if you're feeling kind of wacky, I think it's okay to ask some questions and find out maybe why that is. There's also just like, what do you want to take with you? How long are you going to be there? What do you want to take with you? You know, what's a favorite food? Eat good while you can, and get through it when you can't, right? So there's, chemo, a lot of times you'll feel good for, 24, 48 hours afterwards. It depends on the chemo, it depends on the dosage, all of that kind of thing. But then for me, I wouldn't feel so good for a couple of days. And by not feeling so good, I meant I was laying on the couch more, wasn't throwing up, but maybe just not feeling like I wanted to eat much. It did change depending on what the chemo was that I was taking. All the side effects are different for all these different drugs. So,
and I think most of the people, maybe not. I would assume most of the people watching this are metastatic cancer people, and obviously with the metastatic cancer, they're going to hit you harder if they can. And in Heather's case, she received multiple different chemotherapies on the same day, but it was spaced out 3 weeks apart. Whereas some people are going to get one chemotherapy once or twice a week over a 3 to 4 month period of time. They're going to track the results of that. It just depends. But a lot of metastatic cancer patients that can handle are not going to get one.
Well, I think it depends. I mean, again, it is
depends
kind
on
of
when in the series.
Yes,
too. I mean,
there's all of those things. But one thing is, if it's intolerable, you need to talk to your doctor about it. So they are going to most likely start out with the highest kind of thing that you can handle. But there's also the ability to do lesser doses or to come back more frequently, like you're talking about. So again, this is where it is really important to be talking to your doctor and that whole team. And I will say this is where like portals have made things so much easier because you really can put a message in, and talk to somebody fairly quickly. But just know that chemo is a constantly changing type of thing, right? I think when you're actually getting it, it's all just about being comfortable and
it is. And like in your case, it was, 8 hours of chemotherapy. So that's a long time to pass the time.
Yeah.
Whereas if you're going in for an hour for a drip and going home, well, that's not the case. But, if somebody's in a similar situation as you, what are things that you recommend there?
Well, I just, again, taking some of your favorite things. I guess a lot of places have warm blankets. Ask for them. They're great. I like them. What kind, do you want to play on your phone and do you need a charger or do you want an iPad or something like that? I don't think it's usually the place to like solve the world's problems. So it's more stuff to just kind of keep you busy, Sudoku, things like that. Also maybe some food and drinks that you like and that aren't super heavy or whatever,
Especially the first time.
Yeah.
You're getting it.
Yeah. I had a reaction the first time that I got it, and it just was, my body reacting, and they just backed it off to give me more Benadryl and things like that. But I honestly kind of thought when it was happening, like, oh my gosh, this is chemo. And my nurse was like, no, stop. It's not. This is not how it's supposed to work.
But you don't know.
You don't know.
Yeah.
So, and that it's great. I think I always had somebody with me when I was doing chemotherapy because, again, just somebody to help you, share your thoughts. I guess we could also talk a little bit about ports. I did all of my chemotherapy without a port, which was like the first 4. I did 4 sessions of chemotherapy without a port, and I'd been at that point already, just poked a lot because it's not just the day of chemotherapy, but it's all the blood draws and everything else besides that. So then I did end up doing a port, and I guess I have some mixed feelings. It was great to have it. I had one in my chest for a while. It was not super comfortable. I don't know. I just didn't love it. I ended up actually for over 10 years I had a port in my arm, which I loved. And I got that because when I had decided to do reconstruction, my plastic surgeon was like, your port's in the way, which God bless him for that.
That's got to go.
That's got to go. Yeah. So, even things like that, those are the things that I would encourage you to ask a lot of questions about. Like, or kind of think about what you want. I don't know why they don't do arm ports more often. It was by far so much more comfortable and easier to access in terms of clothing and all of that kind of thing. So, and it just worked so much better. I don't know. So ask the questions, like sometimes I think in medicine we get so used to just, well, this is, quick and the most effective and best or whatever, but it's not best for everybody. And there's a reason that they make arm ports and, so, and also like, even just like if you're not getting a port, I learned to ask for the smallest size needle. Like I still will do that. Like please do the smallest needle you can do. For some things they need bigger needles because they need to be able to, insert something bigger or whatever. But a lot of times they'll go, oh yeah, I can do that, Or you also learn to like, if you're accessed, only be accessed once, so that you don't have to get poked again. There were so many times in the beginning where I would get an IV put in somewhere for something and then they would take it out and I'd get somewhere else and they'd be like, oh yeah, we need to. Well, and I was like, what are you talking about? And
they'd be mad. Why did they take that out?
Yeah. Or the other thing that I don't know if this is the case anymore, but it used to be that like I had to go to like the cancer center to get my port access for them to use it over to scan with. Or, just all of this coordination of things that I didn't know about, and a lot of times I ended up getting extra sticks because I was mad about it. Like I was never nice about that kind of stuff because I felt like it really was something that places could have prevented, just by asking the right questions.
No doubt.
So, but if you can ask about that stuff ahead of time, then you can avoid all of those terrible things. Mm-hmm. So, let's talk a little bit about radiation. Radiation is generally a process where you do a certain amount of treatments, like, Monday through Friday. So kind of, I did 30 sessions of radiation. And I had done that that was my final, like, treatment of all of the treatment that I did before I started on, like, maintenance phase type of stuff. So, I will say, just to start with radiation, the beginning of it was terrible. I know it's very important that they get you lined up perfectly and that they do all of those things, but I found it to be very, very degrading. Like I had already had a double mastectomy, so my chest was completely flat. They came in with Sharpies. They wrote all over me. They said, don't take a shower, like don't wipe it off. We need to be able to see it. And then they also were going to tattoo various places so that they could line those markers up. And I went really hard against that also in terms of, no, you're not going to, like, how big is this tattoo going to be and what's it going to, like, it just, again, felt so dehumanizing to me. And I was really, really upset about it. And I was able to advocate for myself. I do have 2 small little dots. But the whole process, I hope that's gotten better over the years. That's all I can say. I found it to be horrendous.
Well, and it, there was 11 months of history before this of to some extent just being treated like cattle.
Yeah.
And poked and prodded and this
and
that.
Never treated as human. Yeah. And I get it as a healthcare provider, like you're not going to necessarily get personally involved with everybody, but you need to see everybody as a person. Mm-hmm. And that does not always happen. And I think they thought that it was funny, like they were being humorous, and it was not funny to me. No. Not one bit of it. I found radiation to be difficult in that I'm a little bit claustrophobic, so I didn't like the fact that you do kind of get, like strapped down. You have to be in the same spot. I didn't like the whole process of, the actual like doing the radiation. It didn't take long. I was driving a little bit over. We were driving about an hour and a half every day each way to get there. You would go in, wait in the waiting room, get shingles from the guy next door, or sitting in the waiting room.
I don't think he got shingles from the guy. That's not how shingles works.
I know, but it just was like my immune system was, compromised.
For sure.
And this guy that I sat with for like a week and a half, and then all of a sudden he wasn't around, and then he came back and he's like, oh, I just had shingles. And then I was like, oh. Then I was diagnosed with shingles, which was terrible. I'm blaming him.
Which is not uncommon with radiation.
Right.
Just another opportunity for your immune system to get suppressed and for this virus to
pop up.
And it was nasty with Heather, and it's just another side effect, just like all the other things we're talking about, side effects. But this one, just shingles is nasty, and she had it close to her eye, and it can cause blindness. Yeah. Not fun.
Yeah, landed me in the hospital for the weekend. We found it on a Friday. Like, everything about it was just like, blah.
Mm-hmm.
I don't want to, yeah. But
I'm sure radiation's great for other people.
I'm sure it's great. And I think sometimes it's not as long anymore. So I hope that's the case. Again, I hope that we have made some progress and people have learned some things over time.
Mm-hmm. But
just know, even though it's not like a long process, it is an exhausting process, and it does tend to wipe you out a little bit. So again, just, rest is not something you earn. It's something you need rest. So do that.
Yes.
So
especially with doing it every day.
Yeah. Yeah. So, and then surgery. I'll talk about surgery.
Well, why don't you go through some of the surgeries you had related to cancer?
Yeah, so smaller surgeries, I had port placements, right? I had multiple port placements for various reasons.
And if you've never had a port placement, that's a real surgery.
It is a real surgery.
Put you under surgery. Yep.
Well, sometimes you can hear a little bit, and that I wouldn't recommend. I had a surgery for a port where the doctor was training another doctor, or the other way around, and he was mentioning like being careful of certain things, and I was like very traumatized by that. Anyway, I've had port placements. Initially, I also had a double mastectomy. That was my first major surgery for that. Since then, I've had, I don't know what else. The last one was I had a rib resected because just to get a better look at it from to be able to biopsy it.
Reconstruction.
I did have reconstruction. That was a huge process. I will say, going into this first surgery, the double mastectomy, I chose not to do reconstruction because I didn't want to give the time or energy that I knew it would take to, I just felt like it was way more important for my body to heal than to go through a reconstruction.
Right.
And then doing it like 3 or 4 years later, I'm glad I waited. It was really difficult.
Mm-hmm. It was
really taxing also. So, I will say, like, in terms of surgery, I have liked, I think, all of my surgeons, with the exception. I've had a lot of surgeries on my mouth for osteonecrosis of the jaw. And again, they put me under to do those kind of things. It is not just like an oral surgery. It is a real surgery where they're taking bone out, debriding bone, like stitching me back up, going in above my teeth, all sorts of fun things. I've had surgery on my one foot in particular, but I've broken both of my feet multiple times. So I had a pin due to the again, like, Zometa can cause it, while it can strengthen big bones, it causes fractures in small bones. So, and I was very active. I'm still pretty active, but I did that, like, while I was on that, I was playing sand volleyball. I was running. One day I did it on the cross country course. I just stepped on a rock wrong and popped it. And so, but yeah, I've...
So many surgeries.
Many surgeries.
Okay.
Yeah.
So what advice do you have as far as surgeries go?
Well, I can say, like, again, you need to be confident in your surgeon. I have a decent relationship with them, I think, is important. One thing that I think makes me a little bit different at the very beginning, my first breast cancer surgery, like the double mastectomy, I remember saying to the surgeon, like, if you see anything like terrible in there, please don't talk. Like, please don't say, oh, she's done, or whatever that looks like. Like, please stay positive, or if you need to say stuff, keep it professional. Like, I know my brain is still hearing that kind of stuff. So I really felt strongly about kind of protecting my mental state, even when I was under. I think other than that, I feel like the first appointment of the day is the best appointment of the day, even though I hate getting up early. I just think the earlier you can get in and get it done, as the day goes on, surgeries keep getting delayed or whatever, you know? So,
for sure.
I think there's been a little bit of research saying that, like, that surgeons are not as good either right before lunch or right after, or both, something like that. So, you know, again, get them fresh and early is good. Bring somebody who can, again, help you communicate. I learned at the Mayo Clinic that I'm a coffee drinker. If they'll give you a caffeine pill, take it. Oh my gosh, it's great, just to help with a rebound headache afterwards. I think depending on what the surgery is, like, it's a lot easier to stay ahead of pain than to have the pain, you know, and by stay ahead, I mean, like, take the medicine, either way.
Even when you're not at an 8 pain-wise.
Right. Especially at the beginning when, you know, we've had things like, you've had muscles cut or things like that, really big stuff, like, do that. It's hard once you get behind pain to kind of catch back up sometimes. So, I'm not a big, like, whatever, I don't even know what they prescribe anymore. I definitely have done the oxycodone, different things like that over time, but we try to kind of wean off those as soon as possible, and have been pretty successful with all of that.
So, you know, how well versed do you think you were in the post-surgery recovery part? Did you think you knew? Do you think you asked enough questions before, you know, about that part of it, or not?
Probably not in the beginning.
Okay.
You know, but I think, I don't know. I remember after the double mastectomy, because I did actually spend the night in the hospital for that. I remember waking up and, like, looking down at my chest and it being completely flat and going, oh, well, okay, I guess it looks okay. I hadn't really processed really what that was gonna be like, you know what I mean? And I will say, so that kind of stuff, there is kind of also, like, how is this impacting me, you know, mentally, emotionally, all those kind of things as well, you know? But I do feel like, I mean, again, I have liked my surgeons. I feel like they've done a pretty good job of telling me, like, I knew what was happening and I knew sort of what to expect on the other side of it. So.
Okay.
Yeah. What do you think as a caregiver for somebody having surgery? What do you think the main things are?
I mean, like, time off and ability to give the proper care and not put the patient at risk, because if you're not there, they're going to do stupid stuff. Yeah. That's part of it. But no, like, doing your homework as the caregiver of you know, especially we had drain tubes maybe multiple times, I'm not sure. But, you know, being comfortable with something like that's a pretty uncomfortable thing to do. Yeah. And, you know, I think organization, especially with kids, if you have kids, and just being able to organize that stuff and really help so the patient doesn't have to worry about all, you know, things, and things are organized, life's just probably going to go better. Yeah. You know, if you're going into it blind with the recovery part of this, it's probably, you know, nothing really is going to go great, in my opinion, if you don't plan and execute that. But that's just how my brain works, though.
Yeah, and I would say for surgeries that you can plan, like there is okay. I think it's okay to ask about certain dates or will this work or will this not work. I mean, I remember we actually did my double mastectomy right after the 4th of July, so we did try to like enjoy the 4th of July and then do that.
Yeah.
But then I've worked in the schools for so many years too, and I've had to, like, I had one big surgery on my mouth. No, maybe that was the rib thing. I had it before Thanksgiving. And so I could kind of only take a couple days off and then be off for 3 more weeks. And like, I kind of could make the most of the time off that I had coming anyway. So, I mean, again, all of those things are important to think about, you know? So, yeah.
Okay, so immunotherapy, not necessarily your expertise.
Not at all.
This, yeah.
No.
Yeah.
I mean, just what do you need to be aware of? I know, as I watch a lot of people start on medicines that are more targeted, I think the question, just what are the things you need to be aware of, like to be concerned about? Also just kind of, how are you going to get it? What's your schedule going to look like? Pharmacies, all of that kind of stuff. Like, what does that look like? Right. So it's just a different type of schedule. And again, I think that one's a little bit more focused on what we started out by talking about with that whole scan, treat, repeat kind of situation, right? For sure. So, yeah. But, I think the more you feel comfortable in a medical setting, the better off you are,
And that goes to the mental side. Right?
Yep.
I mean, we got to have confidence in whatever is happening is actually working.
Yeah. And
this very, very, very powerful organ that we call a brain is going to work better.
Yeah, for sure.
Yeah.
So, all right, cool. So next time we'll talk about our support system.
We will.
During the treatment phase. So, all right. See ya.
See ya.